In the preparation of these workshops, the name Ballint came up a lot. Could you tell us a bit about Ballint?
Yeah. Ballint was a Hungarian refugee, came to England before the war, a doctor. He trained as a psychoanalyst, and he developed a method of training GPs to hone in on the core complex, the core dynamic complex of a patient within the normal time limit of a consultation, i.e. in 6 minutes. So within 6 minutes, this technique that was developed by Ballint involved getting to asking the questions about the presentation, understanding something of the patient's history, linking the symptom to the history, and also linking it to something that's going on in the here and now of the patient's life. And wrapping that up, all in 6 minutes, was a technique that he developed, and then ran a number of regular ongoing seminars and workshops for GPs to teach them this, to train them in this method, and that became called it was called the Ballint groups. Ballint groups, and they were made famous by him, and they published, and his wife also was a psychoanalyst, and she was interested in this field as well. So the two of them formed a very significant pair in developing this work.
And its relationship to our workshops?
It's related because I would say that our workshop is a grandchild of the Ballint method, the slight difference being that the introduction of the academic element. But the method of case presentation, case discussion, honing in on the core dynamic issue and presenting that to the patient in order to form an insight that the patient would go away and think about. That bit of it resembles Danny. Can you think of a case where the presentation seems a reasonable one in osteopathic terms, but you observe that there is something psychological, emotional in the communication, and you try and put it into words? Can you think of an example?
Yeah. Well, I've got a case at the moment whereby in the first session the patient became tearful, crying quite a lot, mm-hmm. within the first 20 minutes, mm-hmm. Describing her symptoms, describing the cause of her symptoms, and in my mind, a clear connection between what was going on emotionally in her life, be it within what she described to me as problems in the marriage, an ill child, and a long history of...
Yeah. What was the osteopathic reason for being there?
Hip and knee pain.
Oh, okay, so you would have lots of referrals of that nature,
Very
I
common.
presume.
Very
Hip
common.
And knee pain.
Yeah.
Okay. But this time, the patient is in floods of tears.
And the onset of the pain doesn't seem to me to fit with her symptoms. So it occurred when she was forced to leave the house at a time when builders were there. In the words she used, she was expelled from the house.
By the builders.
And she went for a walk, and the pain came on during that walk.
Okay.
And furthermore, on my osteopathic examination of the hip, she had full range of movement, both actively and passively, and didn't seem to fit in to any of the orthopedic pictures, nor did her description of the pain fit in with what I could see happening. So she described an inability to walk upstairs, yet she'd managed to come to my treatment room, and my examination didn't seem in any way to reflect that.
Okay, very interesting situation, because she tells you early on in the consultation there are problems in the marriage. Presumably you must have shown some empathy when she cried, and then she went on to say problems in the marriage, a sick child as well. Would you see yourself as an osteopath asking more questions about that area of her life?
Yes, I would. Normally my approach would be to ask if there's any stress. If there's anything, if it's a stressful time in their lives. That's normally the way I... Not do you have any psychological problems, obviously. Is this a stressful time in their lives? Is there anything... Is it more stressful than usual at the moment? And normally I get one of two reactions. Or three reactions. One reaction is everybody's life's stressful. Everybody's life is stressful. Which is sort of like a way of saying... It's kind of a stop sign to me really pursuing that. Some people may say, it is a stressful time. Yes, this is happening and this is happening and this is happening. And some people will say, no, nothing stressful at the moment. Which also for me raises a question, because the truth is everybody does have something stressful in their life.
Okay, so do you have a technique, or a response rather, to each of those three possibilities?
Well, if I get the stop sign approach, I'll normally back off and approach it at a later date. That sometimes works. Sometimes they may start to talk about their life, or I may ask them about their work, and then sometimes they may give me a window to pursue further questions about their work. And sometimes I may say to them, it may come up, and where they're describing something stressful, and I may say, well, actually, that sounds like there is something stressful going on in your life.
Right. Well, that's a very interesting example of what we try to achieve in the workshops. In other words, to help the osteopath increase their repertoire of responses to patients' communications. So the first one might be dismissive. Next one is denial, and a third may be an invitation to ask me more questions about the stress. Okay, so that increases the repertoire and makes the professional life of the osteopath more satisfying, I presume.